Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. Hey guys, welcome back to the podcast. Today, I wanted to talk to you about dementia and memory loss. Now, not all memory loss is dementia. Oftentimes, memory loss can be a typical part of the aging process. However, a lot of times when people notice memory loss either in themselves or a loved one, they can get very concerned and worried about dementia, and rightly so. It's a sad progressive disease, and we definitely want to be proactive about managing it if that's something that does come up. So today, let's talk about some of the differences between the two, some of the things we can do to help prevent memory loss or combat it, and when it might be time to talk to your doctor about dementia and even perhaps start to consider getting the person affected some more help and support either in the home or removing them from the home. So, some examples of age-related forgetfulness in contrast with dementia. So, every now and then making a bad decision once in a while is typical and expected. I like the joke that if you have a belly button, you are not perfect. So there's an expectation really at any age that you'll have some bad decisions. However, if you are making poor judgment and decisions a lot of the time, or someone feels that it's the majority of the time, that may be a sign of dementia. If you miss a monthly payment on a bill once, not a big deal. That's some regular forgetfulness. However, if you're frequently recurring having problems taking care of monthly bills, or many different bills are going unpaid or even piling up in the mailbox, that can be some signs of dementia. If you forget which day it is and later on you remember, that's normal forgetfulness. I think all of us have experienced that at some point. However, if you lose track of the date or time of year frequently, or even what year it is, that's definitely some more concerning signs of a higher memory issue, such as dementia. If you sometimes forget which word to use, again, very typical. I think that's happened to all of us. However, if it's to the point where you're having trouble holding a conversation, more significant could be dementia. If you lose things from time to time, again, happens to all of us. But if you are often misplacing items and unable to find them, could be a sign of dementia. Some other signs you want to look out for in your loved one that could be dementia, or just otherwise that they may need some extra help, could be confusion or uncertainty when performing tasks that are routine, that you're used to them being able to do without issue. If they are having trouble with their keeping up their personal hygiene, or you notice that the person or their home is unclean, or smells bad, and if you've noticed some weight loss in them, or perhaps they've lost their appetite. Mood swings would be another issue to look out for. If you go over to their house and you open up the fridge and you notice there's spoiled food in there that's just not getting thrown away, those are some signs that perhaps we have some more significant cognitive impairment going on. Now, age-related forgetfulness, if that's the category you're falling into, there are some things you can do to improve that. Staying active, both physically and mentally, are going to help. And of course, avoiding alcohol and eating a healthy diet. I think that helps just about every medical condition. Different brain games can be helpful. The science is unclear. Same thing with some supplements. Before you start any supplements, of course, talk to your doctor. Most of them are benign, but some of them can interact with other medications. Some of them, quite frankly, may just be a waste of your money. So speak with your doctor about supplements, but there are some interesting findings coming out on different mushrooms and whatnot. So talk to your doc and see if that could be helpful for you. Another thing that I saw recently on the news is that they're actually finding a link between hearing loss, untreated hearing loss, and early onset dementia. Something about they've found something about the social aspect when people lose social interaction. Those people tend to see a dementia onset earlier than people who are very socially engaged. So number one, staying socially engaged, but number two, also making sure that you're getting your hearing checked, particularly if other people have noted to you that they're speaking to you and you don't hear it, or if that's something you notice about your loved one, bring it up to them. So these are some things to look out for. And hopefully that helps to differentiate some of the differences between normal age-related forgetfulness and dementia. If you have concerns for dementia, please reach out to your provider. You can start with primary care doctor, and they can go through a more thorough evaluation and refer from there as necessary. If ever somebody does have dementia, or even if you're waiting on a diagnosis, but they have a lot of these symptoms that we've talked about today or signs that you're seeing, we should start to think about if they're safe in their home. Do they live alone? If they do, that's a huge risk factor. And we need to start thinking about if that's the safest option for them. Perhaps they can stay in their home and we can get some help. Perhaps they can move in with another relative. Perhaps we need to start looking at assisted living. These are not easy decisions to make, certainly don't happen overnight. So a good time to start thinking about these kind of things. And of course, as much as you can, involve the affected person in that decision making. Can also help you with weighing out these kinds of decisions and what may be best for you and your family. So if this is something you need help with, please don't hesitate to reach out. Or you can also go to gnanow.org to find an advocate that's local to you. So I hope this was helpful. As always, if there's something you'd like to hear on the podcast, please reach out and let me know. We'll get that topic on. And I hope this was helpful for you. I'll see you next week.